the governor's second test negative. He tested positive earlier in the day. That first test taken as a precaution because he was scheduled to welcome President Trump to Ohio. Now, these two tests given to the governor are different types, but with two different results, there is still concern.
I don't know where I got it. We've kind of replayed through, where that could have occurred, and we just don't, frankly, we just can't figure it out.
And the 73-year-old governor has personal reasons why he takes this virus seriously.
We're very, very careful with who we see. We have 2 daughters that live down the road. We have 4 grandchildren. Even with them, we wear a mask. Both our daughters are pregnant, expecting babies.
That includes some underlying health conditions of his own.
I've had asthma probably since I was a teenager. Under control, but I take an inhaler regularly in the morning and night.
And for those who think that wearing a mask doesn't make a difference, the governor said that's the wrong lesson to take from his diagnosis.
If people, take that lesson from the fact that I apparently have it, that would be the wrong lesson. It would be very, very sad, and that will upset me quite a bit.
Well, the first test the governor took was an antigen test, which DeWine admits Ohio does not have much experience with. The second one, the negative one, was a PCR test, which is more common in Ohio. The PCR test checks for genetic material. The antigen test looks for specific proteins. After that first positive test, the governor said he wasn't looking forward to what might come next.
My experience in life is that you learn from every experience. And I'm sure this will be an experience. Not one I was looking forward to, not one I wanted.
Well, this afternoon, DeWine said that he would spend the next 14 days in self-quarantine. So far, he has not said anything differently. Now, the governor says that he has towed the line when it comes to masks, and his case has now raised questions in some people's minds about social distancing rules.
WCPO 9 News reporter Jake Ryle taking a closer look at that for us tonight.
Governor Mike DeWine said multiple times he feels like he did everything he could to protect himself from the virus. But even at that, going out and about is still a game of odds. The news came before a visit with the president.
That I had tested positive. So that was a big surprise.
Ohio Governor Mike DeWine has touted safety precautions for months, wearing a mask and being socially distant.
When you wear a mask, you're improving your odds dramatically. But that does not mean you won't get it.
Melba Moore, Cincinnati's health commissioner.
The question is, what's the sensitivity level? You have to understand that, and then what is the type of test that he's taking now? Is it the PCR COVID testing?
Her focus, closer to home, is to give a bit of guidance for those who question.
What we did is working, and it's all of us working together. So I'm very pleased at that.
Hamilton County's response to the virus has improved, moving out of the red level public health advisory and into orange.
From some of the science, we know that 80% of the population, community people, wear masks consistently as they should. We know that there is likelihood of a reduction of cases, a reduction of positive cases.
She echoes the governor's thoughts to wear a mask.
Think about where you're going. Do you really need to go, or out of a necessity, or is it just out of a desire?
For those who doubt wearing masks, officials say the science is there. It doesn't make you immune from contracting COVID-19, but it puts the odds more in your favor.
This virus is very tough. And yes, you can contract it even when you're being very, very careful and even when you're wearing a mask. But your odds are just dramatically better.
Jake Ryle, WCPO 9 News.